Monofocal versus multifocal lenses, the honest truth about cataract surgery eye. As we age, the natural lens inside the eye can gradually become cloudy, leading to a condition known as a cataract. Cataracts may cause blurry vision, faded colors, and increased glare, particularly at night. Modern cataract surgery is one of the most commonly performed eye procedures worldwide. During surgery, the cloudy lens is removed and replaced with an artificial intraocular lens, or IOL. Patients are often faced with an important decision. Should they choose a monofocal lens or a multifocal lens? Let's start with monofocal lenses. These lenses have been the standard option in cataract surgery for many years. A monofocal lens is designed to provide clear vision at a single focal distance, most commonly for distance vision. After surgery, many patients can comfortably drive, watch television, and perform distance-based activities with reduced dependence on glasses. However, because the lens focuses at only one distance, reading glasses are often still needed for activities such as reading books, using smartphones, or working on a computer. Monofocal lenses are known for their reliability, excellent image quality, and strong contrast sensitivity. Now let's look at multifocal lenses. These advanced lenses are designed with multiple focal zones that help provide vision at far, intermediate, and near distances. For many patients, this can significantly reduce dependence on glasses during everyday activities. Patients may be able to perform tasks such as driving, computer work, and reading with greater convenience. However, because light is distributed across multiple focal points, some individuals may notice halos or glare around lights, particularly at night. A short adaptation period may also be required as the brain adjusts to the new visual system. Financially, premium multifocal lenses can increase the overall cost of cataract surgery in many Western countries, often resulting in several $1,000s of additional out-of-pocket expense per eye. This has encouraged some international patients to explore treatment options in India. JCI-accredited ophthalmology institutes in India offer advanced cataract surgery technologies, internationally recognized surgeons, and access to premium global lens brands at significantly lower costs. Ultimately, the right lens depends on your lifestyle, visual priorities, night driving habits, and budget. Always undergo a comprehensive eye examination with a qualified ophthalmologist before choosing an intraocular lens. Knowledge is your best tool when protecting your vision. Subscribe to Cure in India for more honest, data-backed medical insights and healthcare guides.